Sir, what is the meaning of this T3, N1, M1? So you should know. That's why I told you. What is the difference histological, well differentiated? What is the difference between clinical staging? Because these words you will find somewhere written, and then you should not be lost that I don't know what is this. Once those words come in front of you, you will remember, Arey, this is the very bad, this is simple, this is not very serious. That much only you remember. These words will be there in the prescription, in the diagnosis. So you should not lost. Kya or kya pata nahi chala mere. So all the different types of names, different types of diagnosis written that you should know. Okay. Now we'll go to the causes of the cancer. Now, what are the risk factors? As you know, I told in the principles of yoga therapy that we don't know the cause of the cancer. So we don't know the treatment of the cancer. As we know, suppose the patient of typhoid comes. Now we know which organism is causing typhoid. So we give the tablet, antibiotic, which kill that bacteria. So patient is cured. Now in cancer, we don't know the cause of the cancer. There is no organism, there is no bacteria, no virus. Then we don't know the treatment. So what we do, whichever part is affected, we cut it, we remove it. But suppose we remove it also, some of the cells, they do remain in the body because we don't operate with the microscope. Suppose patient has got cancer over here. So we cut from here. But some cells along the blood vessel, they might have gone over here. And they grow slowly. That is called metastasis or secondary. That is why we don't know the cause of the cancer. So we don't know the treatment of the cancer. But what has happened in last 50, 100 years? We have got so many cancer centers and patients, they are coming to the hospital for treatment of the cancer. So when we write the history of the patient, we ask them their habits and we tick mark it. Now there is a department called Cancer Registry Department. So any hospital, if the patient of cancer is diagnosed, his history and his name has to be reported to the Cancer Registry Department with all details of the history. So what we do, suppose we take 1,000 cancer lung cases. So we find out the habits, what were the habits of these patients. So we see that 90% of the patients were smoking cigarettes. So we say that cigarette smoking may cause cancer. So these are all probable causes. Why I have given you importance to tell you before the causes is, these are not definite causes. These are attributable causes. We just say, because we see most of the patients smoking, those who have got cancer lung. So we say, so these are the common risk factors. The first is a tobacco use. Third is alcohol, overweight and obesity. Dietary factors including insufficient fruit and vegetable intake. Physical inactivity. That is also one of the cause of cancer because the cells, they behave abnormally. Then chronic infections like Helicobacter pylori, hepatitis B, hepatitis C, and some types of human papillomavirus. They act as a precancerous. We don't know. Not all the patients having H. pylori infection will get cancer. Some may get. Similarly, some hepatitis B virus may get cancer of the liver. Then environmental and occupational risks, including ionizing and non-ionizing radiation, chemicals and pollutants. These are the different causes of cancer. Now, chemical carcinogens, several chemical and environmental toxins are responsible for changes in normal cellular DNA mutations are known as mutagens, and mutagens that cause cancers are known as carcinogens. Whenever these chemicals, when the person comes in contact with those chemicals, suppose he is inhaling the fume, because if that chemical is there into the environment, it is there into the air, and same air is breathing in. So when those chemicals, they go into the body, they have got effect onto the cell. And which part of the cell? The DNA of the cell. And the DNA gets mutated, means it becomes abnormal. So that is called mutation. So the chemical which can cause mutation of the cell is called carcinogen. So some of these are carcinogens. So these are seen into the, like in tobacco smoking associated with many forms of cancer, causes 90% of cancer lung. Similarly, prolonged exposure to asbestos fibers is associated with mesothelioma. Tobacco is also related to other cancers such as lung, larynx, head, neck, stomach, bladder, kidney, esophagus, and pancreas. And it contains other known carcinogens, including nitrosamines and polycyclic aromatic hydrocarbons. So you need not remember all these things. You can just remember that the chemical which can change the DNA or mutate the DNA, that is called carcinogen. And these carcinogens, they are seen in many chemicals or toxic environment problems which can cause cancer. Now, another is ionizing radiation. Radiation caused by radon gas and prolonged exposure to ultraviolet radiation from the sun can lead to melanoma and other skin malignancies. If patient stands hours together in the sun, sometimes because of the prolonged exposure to the sun, he may get cancer. Then radiation therapy given for one type of cancer may also cause another type of cancer. Who receive chest radiation therapy for lymphomas may later develop breast cancer. If you remember, or if you have observed, the technician, X-ray technician who takes your X-ray, if you have seen at his collar of the shirt or the apron, there is a badge that measures the radiation. Because whenever patient comes for X-ray, he will take him to the X-ray machine and he will put the button and X-rays will be flown through the body of the patient and X-ray will be taken. Now, whosoever is there in the vicinity of that electrode, he will get the radiation. Now, that radiation will be measured by that gadget the technician has got. Because patient will get only one. Because when he will go on and lie down on the X-ray table, and when he will put the button on, the X-rays will be thrown, he will get some radiation. But the X-ray technician is working 24 hours in the department. So every patient coming, he is getting exposed to the radiation. And that is why this gadget is, because this gadget was started about 50 or 60 years ago. Before that, that gadget was not there. But then what happened? Then we found that some of the technicians, they got cancer. So later on, it was discovered that because they were exposed to the X-rays, they got the cancer. So now they are given gadget over here, and it gives how much X-ray his body has faced. So that level has been decided. If that particular level is crossed, that person is asked to get out of the X-ray department till that X-ray radiation level comes down in his body. Then second is viral and bacterial. Include liver cancers due to hepatitis B and C infection, cervical cancer due to infections with human papilloma HPV. Now, these are also seen in some of the patients. Usually hepatitis B or hepatitis C, when the patient gets that infection, after few days, he may get liver cancer. Then another is the EPV virus, or which is seen in the Burkitt's lymphoma and H. pylori infection into the CS stomach. So these are the few of the causes of the cancer. Now, genetically inherited cancer. Common examples are inherited breast cancer and ovarian cancer. Now, they have got the data and they found that this patient has got breast cancer. Her mother was also having breast cancer. Her mother's mother also got breast cancer. So, it is inherited. But it is not 100%. It is sometimes in some cases it may be 5%, in some cases it may be 10%. Then this is the P53 gene that leads to bone cancer, breast cancer, soft tissue sarcomas, and brain cancer. Then hormonal changes. These are more, there are many hormones in the body, but one of the most notable among these are changes in levels of the female hormone estrogen, which has been linked to uterine cancer. Till the time that estrogen is there, usually they don't get cancer. But once the estrogen level goes down, they may get uterine cancer. Then cancer of the immune system. Impaired immunity involving HIV infection leads to several cancers, including Kaposi cancer, non-Hodgkin's lymphoma, and HIV-associated malignancies such as anal cancer and cervical cancer. When immunity is down, because of some, it is usually seen HIV infection. So there, they may get these different type of cancer. Now, pathophysiology of the cancer. In normal cells, genes regulate the growth, maturity, and death of the cell. The genes which are there into the DNA, into the cell, they govern the activity of the cell. Genetic changes can occur at many levels. There could be a gain or loss of entire chromosome or a single point mutation affecting a single DNA nucleotide. We are not sure where it acts, but if it is affected, then it may be at different levels, and accordingly you may get the, because as if DNA is affected, the production of the cell, the death of the cell, maturity of the cell, all depends upon this is the programming done into the gene. Now, if this programming is affected by any reason, then the formation of the new cell is a abnormal cell, which is called a cancer cell. Now, there are two broad categories of genes which are affected by these changes. Oncogenes, these are the cancer-causing genes. They may be normal genes which are expressed at inappropriately high levels in patients with cancer, or they may be altered or changed normal genes due to mutation. In both cases, these genes lead to cancerous changes in the tissue. Now, this programming, if it gets changed, then these oncogenes also get changed. And when oncogenes, they start acting on the cell, governing the cell in function, the abnormal cells are produced, and that's why they are called oncogenes. Then these are the tumor suppressor genes. These genes normally inhibit cell division and prevent survival of cells that have damaged DNA. Means normally in our body, if the cell is abnormal, when new cell is produced, by mistake it is produced abnormal, body has got its own mechanism to kill that abnormal cell. So that is done by the tumor suppressor genes. They watch, this is abnormal cell, kill it. Because if it remains and that cell produce again new cell, it will be again abnormal cell. And so it will go on increasing in size and form the tumor. So that is why this should not happen. So body has got its own mechanism which tries to control or kills the abnormal cell, and it is done by the tumor suppressor gene. This is caused by cancer promoting genetic changes. Typically, changes in many genes are required to transform a normal cell into a cancer cell. Now, this is a very complex mechanism. You need not remember all these things. You can just remember that some of the cancers are hereditary, and in that, these abnormal genes, the programming is done wrong way into those particular genes, and that is why the abnormal cells are produced, and that is how the cancer develops in the same means mother has got cancer, so daughter also gets cancer of the same part. Tumor in Latin means a swelling, but not all swelling are termed as a malignant. A tumor in Latin means a swelling, but not all swellings are tumors in the modern sense of the term. Means tumor, usually the common man says he has got a tumor. अभी ट्यूमर हो गया मतलब कैंसर हुआ ऐसा नहीं है. That is what he wants to tell. In Latin, tumor is said the swelling. Now, suppose somebody gets a swelling over here, which is very soft, which is called lipoma. From practical point of view, it is also tumor, but it is not the cancer. Some of them may be caused due to inflammation. Suppose somebody gets injury, मार लग गया, तो सूजन आ जाती है. So that is also a tumor, but it is due to inflammation. Then सब किसी को cyst होता है, sebaceous cyst. Yeah, it is filled with the water, right? It will fill with the some liquid, but it is benign. So cancerous tumor has the capacity to grow rapidly and to metastasize or spread to other parts. Some tumors like leukemias grow as cell suspensions, but most grow as solid masses of the tissue. Now, why I told you this example, you might have seen somebody has got a swelling over here. आप पूछेंगे उसको कितने साल से, बहुत साल हो गया. किसी को यहाँ पे स्वेलिंग होता है, फिर वो पूछते बताते हाँ मैं डॉक्टर के पास गया था, वो बोला कुछ नहीं, चर्बी की गांठ. इट इज कॉल्ड लाइपोमा. सो इट इज बेनाइन. बेनाइन मतलब क्या, कि वो कहेगा कि दिस ट्यूमर इज देयर, दिस स्वेलिंग इज देयर फॉर लास्ट 20 years and it is of same size. So it is called benign. Benign means it is not troublesome, it is not dangerous, it is not risky. If it remains for lifelong, patient will not have any problem. So that is called benign. The body is made up of trillions of cells, and these cells grow and die, and the DNA controls it. But we have discussed just now. During development, normal cells rapidly divide to allow for growth. This is in contrast to adulthood, where most of the cells divide only to replace burnout. In children, what happens? He has to grow. So when the cell divides, it divides to have the growth. But while in adult patient, it is only to replace the dead cell, because lakhs of cells are dying and lakhs of cells are produced. So they only replace it. So this is the difference between the children and the adult people. When cell of the body at a particular site starts to grow out of control, they may become cancerous. If they form abnormal cells, not identical with the mother cell, then it is termed as a cancer. Instead of dying, cancer cells continue to grow. 1 minute. Yeah, थोड़ा बैटरी डाउन हो गया था, कनेक्ट कर दिया. Now, when the normal cells divides into two normal cells, there is no problem. But when one normal cell divides into two abnormal cells, now this abnormal cell, the DNA of that abnormal cell doesn't allow to kill the abnormal cell. So that abnormal cell will produce another abnormal cell. And as I told you, that the bone, the cell, the DNA has got ability to kill the abnormal cell. So if a single normal cell divides into one normal and one abnormal cell, that cell will kill the abnormal cell without any problem. But when this becomes cancerous, this abnormal cell, the DNA of that abnormal cell, when it divides into two abnormal cells, it will not kill that abnormal cell. That is the difference. And that is why they go on growing and they form a big tumor. So this is the difference between the cancer cell and normal cell. In addition, these cells can also invade other tissues. So they suppose this part is affected, they will grow and go to the surrounding part also. This is a property that normal cell does not possess. So the normal cell and cancerous cell, what are the differences? Normal cell, if it divides into two, and if one of the cell is abnormal, this normal cell has got ability to kill that cell. While in cancer cell, the ability to kill that abnormal cell is not there. Second thing, this normal cell will not encroach on the surrounding tissue, but cancerous cell will encroach on the surrounding tissue. This is the proper different difference between the cancer cell and normal cell. Cancer cells originate from normal cells when their DNA or blueprint within the cell nucleus is damaged. The programming gets disturbed, and that is why the abnormal cells are produced. Now, DNA is damaged, then the body safeguards against cancer by number of methods, such as apoptosis, which I told you just now. Suppose when two cells are formed, if one is abnormal, that will be killed. So this is a normal property of the cell, that is apoptosis. But if it is a cancerous cell, that is not there. Mutation. Mutations are any changes to the DNA of the cell. There are many types of mutation. Mutation means that DNA, it gets mutated, means there are some changes. That means the programming gets disturbed. Those in machinery, this causes accumulation of errors rapidly in the cell and its progeny. Those in signaling, so either error correcting machinery, signaling machinery, and those that allow the cells to migrate and disturb more healthy cells away from the primary set of origin. Those that make the cell immortal so that the abnormal cells refuse to die. So these are called mutations. And it will depend upon which part of that cell or DNA is affected. Accordingly, the new generated cell will look like. Now, commonly seen cancer, head and neck cancer. This is the buccal mucosa, the mucosa which is lining inside the mouth. That is called buccal mucosa. Usually, you will find more cases of cancer of buccal mucosa. Why?
Tobacco.
Yes, tobacco. Right. Then tongue, larynx, and gums. In respiratory system, lungs and bronchus. I have made this bold at places. So these are the common. Usually you will find more cases. The lungs, you will find more cases. Digestive system, you will find more cases of esophagus, stomach, colon. You may also find in liver, gallbladder, CBD, and pancreas. In excretory system, you will find in the kidney, bladder, or prostate. But in bladder and prostate, it is more common. In reproductive system, testes, ovaries, uterus, and cervix. But Ovaries, uterus, and cervix is more common. In CNS, brain is more common. Spinal cord also sometimes you will find. In ENT, maxilla means this is the maxilla. So it will be seen in maxilla. And the miscellaneous may thyroid, breast, then leukemia and Hodgkin. Pituitary also they are seen, but not much. Osteosarcoma. So which patients will get commonly? Buccal mucosa, tongue, larynx, gums, lungs, esophagus, stomach, colon, bladder, prostate, ovaries, uterus, cervix, brain, maxilla, thyroid, breast, and blood cancer. Now, all these cancers, they will be coming with you diagnosis. Suppose it is a case of buccal mucosa. So it will be written adenocarcinoma or squamous cell carcinoma, well differentiated, stage 1, stage 2, or T1, N0, M0, like that. So that you have to remember, and you will see that if the prognosis is good, if it is stage 1 or stage 2, if it is well differentiated, if it is T1, N0, M0, that means these patients will have better prognosis. So you can give them more yogic kriyas so that they will have little better life. Now, what are the clinical features? Now, usually its entry is silent. Patient does not come to know. When he comes to know, it is usually late. Why? Because it takes a backdoor entry. Usually you must have seen that some patients, they are diagnosed as a case of cancer. You ask them, when you got diagnosed? I went last week for some pain, and then doctor did investigation. They said he has got cancer. Then he said, रिलेटिव को पूछा होता वो लास्ट स्टेज है. अभी 8 दिन पहले तो गया ना पेशेंट डॉक्टर के पास. हाउ इट बिकेम लास्ट स्टेज? बिकॉज he got the cancer at least 6 months back or 8 months back. That time he doesn't realize. So that's why it is called, it takes a backdoor entry. Patient does not come to know. When he comes to know, it is usually late. When he gets some symptom, he goes to the doctor. Doctor does all investigations and they say, अरे इसको तो कैंसर है. अच्छा तो ट्रीटमेंट दे दो. नहीं, लास्ट स्टेज का है. अरे 8 दिन में कैसे लास्ट स्टेज का हो गया? Because patient does not come to know, it takes a backdoor entry. Now, what are the symptoms? They are very common symptoms. Common symptoms like loss of weight and loss of appetite. Why? We have seen that tumor cells, what they do? They take the nutrition from the parent body, but does not do any function. That is why patient becomes thin and lean and cachectic. Now, then symptoms may be due to involvement of particular organ, involvement of the adjacent organ, and involvement of the distant organ. Now, suppose it is a involvement of the particular organ. Suppose he gets a stomach cancer. So what will happen? He will get pain in the abdomen. He will get loss of weight, loss of appetite. Loss of appetite means he will not feel like eating. भूख नहीं लगेगी उसको. फ्रीक्वेंट इंडाइजेशन होगा, अपचन होगा. तो ये हो गया पेट का. इफ इट increases, if it is not diagnosed, what will happen? Next to this is what is here? Liver, then spleen. So if it gets involved, then what will happen? He may get jaundice, he may